appreciate folks' attention to this really important issue. I want to just start by saying that for most of the last 20 years, I've had the privilege of working with programs that are serving young people from 5 to 25 and helping them to implement positive youth development practices and train their staff to be able to engage with young people. One of the things that we see is that the folks who are 17, 18, 19, 20 have much more in common with the what we call juveniles now in terms of their development than they do with the folks who are 20 and over. And that's a really important piece, because what we're saying to folks is that we're going to put you into programs and put you into custody with people who are most unlikely and in a system that is not really built to support your development and not really built to be able to address your needs. And what we have available to us in Massachusetts is a wonderful juvenile justice system that has, over the last 20 years, more consistently implemented youth development, has, over the last 20 years, reduced the number of folks who are in the system by doing a better job when they come into contact with them, by doing a better job of deciding when they should be adjudicated, when they should be in confinement. And I have to credit that to not just the folks in DYS, but across the entire system. And that includes the judges and the courts who've done a better job of deciding what the impacts are for young people and having those be what decides the future of those young people. I ask that you make the same decision for 18, 19, and 20-year-olds, that if we put their well-being and their futures and their development first, that we would put them in a system that was better able to support their development. I ask that you put their development and the public safety ahead of the ease of putting them into a system that doesn't work for them. What we've been doing now is putting them in the existing adult system, even though we know right off the bat that the science all is in the other direction, that what is challenging for fully developed adults in that system is even doubly so for emerging adults, and that while it would be rational to say that we should just wholesale change the adult system to fit these 18, 19, and 20-year-olds, we have the opportunity to invest that in the juvenile system and create an opening there with people who are already trained and developed to work with that population. What we know is that the juvenile system is already working with 18, 19, and 20-year-olds who have remained in that system and having success. We've seen recidivism rates going down for folks in the juvenile system. And I tell this to folks around the country, juveniles, folks who've come out of the juvenile system in Massachusetts, these young people choose, they opt in to remaining connected to the system because it supports their development. And so we have a system that is working not just by our standards on the outside, not just by lowering rates of recidivism for young people and lowering their impact on community safety, but the young people themselves are saying that this works for them. Why wouldn't we make that available to 18, 19, and 20-year-olds across the system? And I speak from a person who is working to not only have the juvenile system do well with this, but also working with the emerging adult units across the state, and knowing that they're going to be a great resource, especially for the 20 to 24-year-olds. But we know that those 18, 19, and 20-year-olds would do better in the other system. On the outside, the folks who are working in the community, and I've been for 20 years working with folks, in whether they're in the Boys and Girls Clubs or the YMCAs or job programs, all the spaces that would be interacting with these 18, 19, and 20-year-olds coming back from incarceration, what they talk about is how putting them in the adult system creates so many barriers to their returning to their communities, and that criminal record going with them becomes an impediment for their trajectories and their future lives, and so many opportunities are closed to them. So if we have a way, and we have it already, for them to be in a place that's better for them, in a place that gives them a better shot at changing the course of their trajectory and doesn't put additional barriers in front of them, we should do the thing that is readily available to us, raise the age as soon as you can. And I'm going to say that we've done the work of training sheriffs and courts and judges and all the folks in the system to provide them with the opportunity to treat 18 and 19, 20-year-olds in the way that they should be, in the way that the science tells us to, in the way that we would want any of our 18, 19, and 20-year-olds to be treated. How am I doing on time?